Hello. Let's get this party started. We're going to talk a little bit about chronic care management. And I'm speaking to my nurse practitioners and my physicians. So let's talk about it. So I am Dr. Sheila Fales. I am a family nurse practitioner. Believe it or not, I have been one for over 20 years. I teach nurse practitioner students with Walden University. I do have published articles. My specialty is primary care, adult, geriatrics, and diabetes. I established a clinic in 2014. I started out as mobile. So when my full-time job ended in 2021, I didn't miss a beat. I was already established. I do house calls. I do telehealth. I go into different clinics and say, hey, I can show you how to make more money, make more income and revenue for your clinic. I teach credentialing, coding, and claims and billing. I'm a certified Facebook investigator. I can find everything I need to know about you. And we have virtual assistants for $6 an hour. So I teach nurses, and I'm helping nurses open different clinics. And so we're planning to open different clinics nationwide. So that's why we need you, some nurse practitioners and physicians, to be medical directors and, hey, get you some extra money and or either increase revenue for your clinic if you are in a clinic. We have RNs and LPNs that can establish a clinic and be care managers. So we have an opportunity for you. If you're looking at this recording, then you responded and you are interested. So there's different ways to look at it. We can hire you to be oversight for chronic care management. There's no prescribing, there's no treatment. We can teach you how to do this in your private practice to make money. And, which of course, I guess you'll pay for those services. But we will offer you, if you did for not paying, we can train you and teach you all about chronic care management in exchange for being medical directors for our RNs and our LPNs. So what is oversight? It's different from what we have to deal with nurse practitioners and physicians. It's not a collaborative agreement. I say it's not even a medical director. I don't like that title, because sometimes they say, oh, you can't hire a medical director. It's no treatment. It's no prescribing. We just need you to assist with the billing. We have to, Medicare, you have to bill through a nurse practitioner or a physician. So what is chronic care management? It has been around for a while, since 2015. You can actually bill for non-face-to-face handling patients' chronic care conditions. As I said, now with chronic care management, it's a condition that lasts at least 12 months. Usually chronic is 6 months for us, but for Medicare, it's 12 months. So that's pretty much most of the patients that we see. Chronic care management is strictly virtual. It does not even have to be video. It's telephone, text message, email, at least every 30 days. They even have studies out at this point showing the effectiveness of text messages with these patients. They like it. This is a work from home opportunity. It's completely remote. It can be an add-on to what you're already doing. So who can bill for this? Physicians, qualified non-physician practitioners, that's nurse practitioners, physician assistants, clinical nurse specialists, and or a certified nurse midwife. If you're not either one of those, you can get in as a rural health clinic or FQHC. Who can do it? Everybody I just talked about, a physician can do it, or a non-physician practitioner. Anybody that you train can do this. My 16-year-old niece can do this. I did 20 phone calls a day on Saturdays and Sundays. They hear me do it over and over and over again. So I don't trust Joe Blue off the corner to do it. But if it's somebody that you train and certified, they can do chronic care management. And also, we offer virtual assistants who can assist you. They can't do the phone calls. This is a government deal, and our virtual assistants are international. They can help with the scheduling, charting, and documentation. But what are those chronic conditions, those things we see all the time? Hypertension, diabetes, stroke, CAD, CKD. And guess what? These patients are not always old. I have 30-year-olds, 20-year-olds on chronic care management. As long as they are disabled, autism is one of those chronic conditions that apply. So what do? This is your company. You decide what you want to do. Me, I like keeping up with their flu shot, COVID shot, making sure they get their A1C every 3 months. Guess what? I like medication reconciliation. It is not required. Check the CMS website. You may say, hey, I don't want her doing medications. But it's important because you know how medications get lost. They didn't get refilled. They were supposed to continue to take it. I like being there when stuff is going on. They lost a family member. They've been in the hospital. I'm big on that. Education, diabetes education, community resources. You're going to have patients with lights off, no money for bills, for food. So that's what we come in at and can be a resource for primary care providers. Hey, you may want them to, hey, they send me my report. I don't know what this stuff means. You can break it down, talk with the patient about, hey, this is what it says. You got pockets in your colon, avoid nut seed, that kind of stuff. They need us. But sometimes the providers do not share that with the patient. So you will need an initiating visit, which I love this. The annual wellness visit can be done by RN or LPN. Now, I pretty much do our regular E/M visit, which is a regular office visit, but pretty much you can get chronic care management started by RN or an LPN. The annual wellness visit is virtual. It does not include labs. It does not include treatment. And like I said, it can be done by RN, LPN, NP, or a physician. So we do comprehensive. We look at it all, physical, mental. We're going to do a cognitive assessment. We're going to check who are your caregivers. How often do you go to the mailbox? What is the poverty level? What is the pollution in your, or we're going to look it up ourselves. But we do the comprehensive care plans. That's why this is so amazing. Primary care providers, keep it real, they don't have time. Not that they don't want to, they don't have time to do that. So software is not required, but electronic health record is. This is one I use. I like it. It keeps you in compliance. It has a timer on it, and it has care plans in it. So what can you get paid? It depends on the plan, the player, the payer, a region. So, clinical oversight, you have an opportunity to make $300 to $400 a month per chronic care management. And as I said, the more cities that you are credentialed in, you have the opportunity to credential more than one person. Guess what? Starting your own clinical practice, we will show you how to do it. This is what we pretty much, we can teach you from the rooter to the tutor. We A to Z. We can show you and your staff how to do it. Option 3, we'll show you how to do it for free. And we'll teach you everything you need to know in exchange to providing clinical oversight. And I would say that's for at least 3 to 4 months. Then you're able to give a fee to that nurse practitioner or RN. It's one more option for my nurse practitioners and physicians who want this as a job. Hey, you don't want to go through credentialing. Hey, we can hire you, give you a salary. So that's option number 4. So in the end, I'm going to have you message me if you want option number 1, number 2. Number 1 is we pay you a flat rate just for oversight. Number 2, do it for yourself, make all the money. Number 3, learn it for free and provide clinical oversight, and eventually you can do it on your own. It will be a 1099 position. Like I said, no treatment, no prescribing, completely remote. This is totally separate from the public health emergency. COVID, like I told you, this started in 2015. Chronic care management is virtual, period, despite the public health emergency. So you're going to let me know, or let us know if you want option 1, 2, 3, or 4. We have enough for everybody. We can't do it all. It's how many million Medicare patients in the United States. So the role of the care manager, which may be a RN, LPN, or a nurse practitioner or physician, we're going to get you enrolled in the insurances if you are not. We're going to have the software available that we can document. They know how to bill. They can do billing for you. If you have patients, that's good. If not, they know how to get their own patients. And they're going to already come with care plans for you to say that it's okay. As we know what to do with the patients with diabetes. Make sure they have a glucometer. Make sure they're on their ACE or ARB. Make sure they're on their aspirin. Make sure they're on a statin or anti-lipid. Missing one. That's 3. Make sure they're getting their A1C every 3 months. We know what to do for these patients. We're already doing it. So I'm reaching out to my nurse practitioners and physicians. Glad that you responded. So like I said, be ready and willing to give us your information for credentialing. This is a plus. If you are not already credentialed, we're going to do that for you. And like I said, you're going to review those care plans monthly. So like I said, we'll provide you with agreements. We're going to start on credentialing. It's those Medicare Advantage plans. Aetna, United Healthcare, Viva, Humana, Blue Advantage, Kaiser, whatever your region is. And we're going to show you how to do it. So we're going to ask you, you can go ahead and send us your resume or CV to arrange the care at AOL, or either just respond, say still interested, because you already said you were. So respond and say that you're still interested. And just, we all need extra income. We need some passive income. So let's get it. Passive income, opportunity to do it on your own. And you know this improves patient outcomes when you keep those patients out of the emergency room, or when you have that patient get that A1C every 3 months. Medicare likes that, and they pay for that. Any questions? So reach out to us. Let us know if you're still interested. It's an opportunity for everyone. Government is willing to pay us what we are already doing. Let's get it. Have a good day.